When it comes to pain in our feet, heel pain is an extremely common complaint, especially among active adults and older people. Joining me now to discuss treatment options is Dr. Trevor Haynes of Elite Foot and Ankle. Welcome.
Thank you.
Okay, so heel pain can make walking, running, hiking, almost any activity miserable. So can you explain what it is and why it causes that sharp pain? And I've experienced this as well, why it's especially bad in the morning.
Yeah, so plantar fasciitis is typically pain right in the bottom of your heel. It's a overuse type injury. It's not something that happens because of an injury. It's just overuse. You're either overdoing it, you started exercising, you started doing more than what you're used to. And it's more painful in the morning because you sleep all night, it kind of contracts, and then you get up, step down, it stretches out, and you feel that pain really intensely in the bottom of your heel.
Who is most at risk for developing heel pain? Certain professions, people who are super active, or who?
Yeah, anybody's at risk, but we see it a lot in people that work on their feet all day, especially like retail workers on those hard concrete floors. Athletes are definitely, especially when they wear cleats, soccer, baseball, and then just runners tend to get it a lot too because of all that impact of that constant running. So it's very common for a lot of people. I think personally, everybody gets plantar fasciitis to some degree within their lifetime.
Yeah. What are some treatment options you offer?
Yeah, so we offer your typical cortisone, although we try, or steroid injection. We try to kind of lean away from that because, cortisone steroids do have kind of a side effect that go with them. So we push more towards things like laser, shockwave type treatments, and ultimately PRP or platelet-rich plasma type injections, which takes your own body's blood, spins it down, and gives you more of a healing effect versus just an anti-inflammatory effect that steroids do.
And then do you also offer kind of custom orthotics for folks who maybe aren't ready to go that route yet?
Absolutely, right? So orthotics are very crucial for plantar fasciitis. Most people could just use over-the-counter, good over-the-counter orthotics. But some do need custom orthotics. We do offer those as well.
And if someone does do the shockwave treatment or one of those platelet treatments you mentioned, what is the typical recovery like for that?
It's pretty easy. You come in, you get the injection or you get the treatment with the shockwave or the laser, and you can go right back to doing whatever you want the same day. Very little downside to getting those treatments, very little pain involved with them. So they're pretty straightforward and pretty easy to do.
And how often does a person need to come in for that? Or I'm sure it depends on the severity of their pain.
Yeah, so injections typically we say once, right? And hopefully they start getting better, and they're gonna do icing and stretching, all those things they do at home. But with shockwave therapy or laser, we typically recommend once a week for about 6 weeks.
Okay, and what's the final straw? If someone's sitting at home and they're like, okay, finally, I'm going to stop waiting and see a podiatrist, what would you say? What's that line?
Yeah, again, I think everybody deals with it to some degree, but I think once it really starts affecting your daily life and it starts limiting your activity, limiting what you do, it's time to get it looked at.
Okay, anything we can do at home to prevent this or a quick relief?
Good shoes, orthotics, and if you start to feel that soreness in your heel, start the icing and the stretching right away.
I was going to say stretching probably is going to help a lot. Okay, where can people go to learn more information? And you have 6 locations now, is that right?
Locations,
okay,
correct.
So tell us where you're located and how people can find you.
Yeah, so they can find us on our website at elitefaor.com, or we have locations in Happy Valley, Canby, Lake Oswego, Beaverton, Tigard, and Sandy.
I know there's 6 now. You had to think about it.
I did.
Well, thank you for coming. It's always great, helpful information. So really appreciate it. Thank you.
Thank you.